Well, I think the most difficult thing in quality of cancer care is, one, the disparities among different hospitals. So I can speak from a United States perspective, that what we find is that there are some places that are doing a wonderful job and others that are doing it in a not as well way. The issue then becomes, how does one get those who are not doing as well better? Without penalizing them, especially those who have a lower resource. So of course the other issue we get into are things that we call risk adjustment, which is, how do I account for your population in dealing with quality? So I think at this point we know what quality looks like. We know how to measure it. The question is, how do you apply it equally across different settings, so that again you can raise some up without penalizing them. So I think those are our major issues right now, is how do we best adjust for quality measures. So we see in the United States huge disparities. We see them across racial lines still in the United States, which have historical underpinnings, as well as we see it by socioeconomic. So by far in the United States, the major reason for disparity is access and stage of presentation. So when we account for advanced stage of presentation in some groups versus others, that explains about 60% of our disparities. The rest comes in the quality of care that people receive. So we know that there are patients who receive care at hospitals and in health systems that are not providing equal level of quality, and therefore don't have the same level of outcome. What we've shown over and over again in the United States is that when you treat people equally, so if we have patients who are treated under the setting of a clinical trial or within one major healthcare system, that we tend to see a lot of these disparities disappear. It's when we allow sort of disparate treatment that we see these disparities persist. Well, I think the most important thing, the things that is happening here within the European Union and things that we are doing in the United States, is setting, this is what quality looks like, right? This is how quality should be practiced. This is how quality should be measured. If we begin there and have an agreement there, then you could begin saying, okay, why are some places providing quality at a different level than others? And how do we rectify that difference? But until you measure it, right, until you have an agreement on what that measure is, then it becomes very difficult to understand. You step back and say, well, we know that there are differences in outcome, but gee, why? Once we are able to say, this absolutely is how cancer care should be practiced across the world, then we're in a position to begin rectifying disparities in care. Well, again, I think what is beginning to happen, and I've just had a wonderful meeting with some of the ECCO leadership, is you look at some countries that are not providing quality of care at the same level of others, and many of the papers and the position statements that have come out of ECCO, you can go, and this gives them ammunition to go to their legislatures and say, look, this is how cancer care is supposed to be practiced. We can't do these things because of the resources that we are being given. And I think when you begin putting that type of pressure on policymakers and say, the reason we are not at the same level as another country is a resource issue, and not just we need more money, but here's where we need the resources directed, because here's where we are falling short. And so I think this is where ECCO has a wonderful ability to say, this is how cancer care should be practiced. And if you're not practicing it this way, then you need to figure out how to get yourself up to that. And I think policymakers respond to that type of, shall we call it, competition very well. I am, actually. I think that, again, more so than any time in my career, I believe we are at a point where we have defined very well what quality looks like in cancer care. And we know how to measure it. And now it becomes a matter of, is there an appetite among the policymakers to take that information and take the quality information that we put forward and build healthcare systems around to achieve that quality? So, it took us a long time to be able to actually measure many of these things. I think we're at a position now where we now have stated very strongly as a group across, between the United States and Europe and within Asia, an agreement on this is what quality care should look like. And that's a huge, huge advance for the care of patients across the world.